Did you ever leave a dental appointment feeling even more confused than when you walked in? Because each dentist you see has a totally different plan for your teeth? Well, you're not alone, and I promise you, there's a clear path through the chaos. Hi, I'm Dr. Daniel Choi, board-certified periodontist since 2011 here at North Texas Dental Surgery. And in the next few minutes, I'll share 7 critical points to help you cut through conflicting advice and finally find the right treatment for your unique smile. By the way, if you like a handy checklist of the questions we're covering, plus a few extra tips, grab our free PDF in the description below. It's the 7 essential questions to ask any dentist before you commit to a treatment plan. You can use it like a roadmap at your next consultation. Now let's talk about that feeling of frustration. One dentist recommends a root canal and crown, another suggests a dental implant. A third wants to do something entirely different. It's hard not to wonder, who do I trust? Am I being sold procedures I don't really need? And those are valid concerns. My goal here is to help turn that anxiety into clarity, so let's dive into why these opinions can vary so wildly. So why does Dr. A suggest a root canal, Dr. B says extraction, and Dr. C proposes a full arch solution? It often comes down to 3 factors. Number 1, training and experience. Not all dentists are created equal. For instance, a general dentist may have strong foundational knowledge, but a periodontist or a prosthodontist could see your case from a comprehensive long-term perspective, especially if your situation is complex. Now, this doesn't mean general dentists can't handle tough cases, nor are specialists always perfect. It's just an important starting point. If your case involves gum disease, bone loss, or full mouth rehabilitation, specialists often have deeper training in those areas. Number 2, treatment philosophies, conservative versus comprehensive. Some dentists want to save every tooth at all costs, even if the long-term prognosis is questionable. Others prefer removing and replacing problematic teeth with implants. Ideally, you want a balanced approach, someone who weighs the value of saving teeth against the benefits of a more comprehensive solution. Personal comfort zone. Every dentist leans towards what they do best, be it implants, veneers, or root canal treatments. Recognizing this bias helps you interpret their recommendations more objectively. Number 3, practice constraints and technology. Let's talk about office setup. Practices without 3D imaging, on-site labs, or advanced technology may not offer certain procedures, even if those procedures might be better for you. And let's talk about group practice advantage. When a practice has multiple specialists, like a prosthodontist, periodontist, or oral surgeon, in one location, you're more likely to get a unified, all-encompassing plan. Now here's a pro tip. If your case is complex, try to schedule your consultation on a day when all the relevant specialists are available. That way, they can collaborate in real time for efficient communication. Number 4, corporate or private equity influence, specifically production goals. Some dental offices are now owned or heavily influenced by private equity or corporate entities. While not always negative, these arrangements can sometimes pressure providers to meet certain quotas or production targets. Similarly, there are financial incentives. A dentist might feel compelled, consciously or unconsciously, to recommend higher ticket treatments if corporate oversight prioritizes profit margins. So what can you do? Ask if a practice is privately owned or part of a larger corporate group. Knowing this context can help you gauge potential financial or procedural biases that could shape your treatment plan. If you're hearing 3 or 4 conflicting plans, here's how to cut through the confusion. Ask to see similar cases. Have the dentist or specialist show your x-rays, CT scans, and photos of patients with issues like yours. See how they approach those challenges and why they chose your specific treatment. Multi-specialty group practice. I can't emphasize this enough. If possible, choose a practice that has specialists, especially a prosthodontist and a periodontist in-house. Prosthodontists have 3 extra years of training, specifically for complex bite and restorative issues, while periodontists focus on the foundation of your teeth, gums and bone. Both perspectives are critical if you're considering crowns, full mouth implants, or bone-related treatments. Prioritize your goals. Maybe you want the most cost-effective route, or perhaps you're aiming for the best aesthetics or longest-term success. Once you identify your priorities, it's easier to sift through each recommendation and decide which aligns with your vision. One of the best ways to avoid piecemeal advice is by consulting a dentist or group practice that takes a big picture view. At our office, for instance, we have a periodontist, oral surgeon, prosthodontist, general dentist, and in-house lab technicians all collaborating. This setup lets us maintain consistent communication. Everyone knows your overall plan, so no details get lost. It also helps us minimize office hopping. You won't be shuttling between places where doctors might never actually talk to each other. Also, it allows us to plan holistically. We consider gum health, bone density, your smile line, and your bite all at once. Nothing is left to chance. Let me share a quick story about my patient Patrick. We actually made a video of his testimonial that you can check out above. He visited 2 different clinics. One dentist wanted to redo multiple root canals and crowns, and he ended up spending $6,000 out of pocket on top of his insurance the prior year. Yet the issues persisted. Even after investing that much, teeth continued to break. So he did his research on dental implants and found our office. Now, after reviewing his scans and learning his goals, less repair work, better aesthetics, and an end to the constant cycle of problems, we designed a single cohesive plan that addressed his chronic pain, ongoing infections, and overall smile by taking a bird's eye view of his entire mouth. We found a solution that finally made sense to him. That clarity made him feel safe and empowered. So if you're torn between contradictory opinions, here's your action plan. Get multiple in-depth consultations. A quick 5-minute chat isn't enough. Ensure the dentist or specialist really digs into your case history, images, and goals. Number 2, ask specific questions. How long will each option last? What are the total costs? Are there hidden fees? What's a warranty or a follow-up care plan? Will I need bone grafts, sinus lifts, or any other additional procedures? Number 3, look at their track record. Ask to see before and after photos or testimonials, especially for cases similar to yours. Number 4, trust your instincts. If a plan feels rushed, unclear, or too good to be true, don't commit until you have all your questions answered. If multiple dentists are giving you wildly different opinions, don't lose hope. It usually means that you need a clear, coordinated plan that aligns with your priorities and sets you up for long-term oral health. If you'd like a comprehensive evaluation for gum health, bone structure, bite alignment, and aesthetics, reach out to us at North Texas Dental Surgery. My team and I are here to help you navigate your options with confidence. And don't forget, if you want a simple step-by-step guide to choosing the right dentist, download our free PDF, 7 Essential Questions to Ask Before You Commit to a Dental Plan. It's linked below. Print it out and bring it to your next consultation. You'll be amazed at how much clarity it provides. Thanks for tuning in. I hope you found the information helpful. Please hit like, share it with someone who's struggling with dental decisions, and subscribe for more deep dives with implants, gum health, and real-life smile transformations. I'm Dr. Daniel Choi, and until next time, remember to take care of that smile and it'll take care of you.